Ensonga z'okuleeta kuno abasawo okuva mu ggwanga lya Cuba zikyalanda. Olwaleero ababaka ba Paalamenti ku kakiiko akalondoola ensimbi z'omuwi w'omusolo batadde omuwandiisi w'enkalakkalira ya minisitule y'ebyobulamu Dr. Atwine ku nninga annyonnyole ku baasinzira okusaba eggwanga lya Cuba okuwa Uganda abasawo.
How did you arrive at the decision of importing 200 or so, we don't know even how many there are, doctors? How did you, is it sustainable? You are failing to motivate your own, and what constitutes ransom? Okay, is demanding for better pay part of ransom?
When we were invited by the president at the time, at the peak of the strike, actually he instructed the prime minister to ensure that we look at that option. It did not, that the decision kind of stayed at that time because people were trying to look at how best this can be done.
Ababaka era bagadde okumanya gavumenti kwe yasinzira okugerekera abasawo okuva mu ggwanga lya Cuba omusaala ogw'obukadde obutaano mu emitwalo 40 buli mwezi. Kyokka Dr. Atwine abategeezezza nga kino bw'atakimanyiiko.
The decision of how much they should earn, who prepared this? Where did this come from?
If the doctors here have been complaining of low pay, you could have raised their money even to less than half of what you are paying the Cuban doctors.
No Cuban has come to Uganda. No numbers are not yet known. How much is going to be paid is not known. The discussion is not yet taken place at strategic level to say this is a report that came from Cuba.
So where did the 5.4 million come from?
I don't know.
One of the ministers in the Ministry of Health mentioned to the Committee of Health, a sessional committee responsible for your docket, clearly that engagements have already been done. These Cubans, they are already preparing for the Cubans to come. Even the amount of money to be paid to them were, you know, it was not a secret.
Dr. Atwine ategeezza ababaka nga basinkana President Museveni ku nsonga eno era bamala okubaganya ebirowoozo ttiimu okuva wano n'eyungulwa okugenda e Cuba mu mwezi gwa March omwaka guno. Abaagenda e Cuba kuliko minisitule y'ebyobulamu Dr. Jane Luther Acheng, akulira akakiiko akakola ku nsonga z'abasawo, amyuka omuwandiisi w'enkalakkalira minisitule y'ebyensimbi, omuwabuzi wa gavumenti mu by'amateeka owa Solicitor General, omuwandiisi w'enkalakkalira minisitule y'abakozi, ssaaka kulira olukiiko olufuga emirimu gy'abasawo olwa Medical Council.
So who constituted this team that went to Cuba?
This team was constituted in that meeting when the president instructed that they need to look at the possibility of getting a replacement.
So the president made a list of those individuals?
They suggested in the meeting, he didn't make, but in the meeting, the decision was made who should represent what.
Ababaka babuuzizza bakungu okuva mu minisitule y'ebyobulamu lwaki ensimbi gavumenti zeyagala okuwa abasawo okuva e Cuba teziweebwa wano nabo ne babeerako obulungi. Kyokka Dr. Atwine agambye nti abasawo abava e Cuba balina obukugu obw'enjawulo obwetaagibwa ennyo mu kitongole ky'ebyobulamu.
We suggest that if we are to bring the specialists in this country, first of all, the specialists should come for a very short term, as government is looking into in the remuneration of the staff.
At least our doctors can understand Kiswahili, they understand Luganda, any other local language. How many of them are you going to attach each of them a translator to start speaking or translating to our illiterate patients who are coming all the way from Karamoja? They don't understand any other language apart from, I don't know.
Ono agamba nti ekyenkomedde ku nsonga eno kijja kusalawo nga bamaze okusinkana olukiiko lwa minisita balunnyonnyole bye bajja e Cuba.